Hello everyone, welcome to the new chapter which is respiratory system. So whenever we study our respiratory system, there is always problem which comes in our contact is bronchial asthma. So let's study what is bronchial asthma and how it is affecting our respiratory system. So for example, in our lungs there is a mast cell present. As you can see, this is in mast cell, and in that mast cell leukotriene is present. As you can see, leukotriene is present in that mast cell. Okay, and there is one antibody is present which is IgE antibody present. Okay, so whenever this IgE antibody get reaction with antigen, it will do one thing. It will open this mast cell and leukotriene will come outside. Okay, and when this leukotriene will come outside, it will cause bronchoconstriction. Okay, because of bronchoconstriction you will have problem in respiratory. So this is what we have to study. Okay, so to stop this bronchoconstriction, what we will do? First thing we can do, we can give bronchodilator. Okay, then second we can give LT to stop LT reaction, like LT receptor, leukotriene receptor. We can stop first thing here. Okay, next we can give mass stabilizer, and the fourth thing we can stop this antigen antibody reaction. So we'll study one by one now. So first, what we are going to study is bronchodilator. Okay, in bronchodilator, sympathomimetics. Okay, and in that it's come beta 2 agonist. So there are 4 drugs which we are going to study. First is salbutamol, terbutaline, salmeterol, formoterol. Okay, and everyone has their specialty. For example, these both are short acting and used in acute attack. Okay, and salmeterol and formoterol are long acting and used in prophylaxis. Okay, prophylaxis of bronchoconstriction or bronchial asthma. So they are given by inhalation route, not by drops or medicine. They are given by inhalation, like pumps we are giving to the asthma patients. Okay, salmeterol have slow action, means it is not acting very fast, it is having slow action, where formoterol has fast action. So if they have uses, always they have side effects. So what are the side effects of beta 2 agonist? So you can remember by T4. Okay, what is T4? Tachycardia means heart rate increase. Tremors means like shaking of hands, and like this you feel like sometimes tremors are coming. T wave changes in ECG. So if you watch my ECG video, I already explained what is hypokalemia and T wave changes and the tolerance. These 4 things you can remember as side effects by T4. Okay. Next is parasympathetics, and in that it's come M3 blockers. We also study these M3 blockers in our parasympathetic system. Okay. Ipratropium and tiotropium. They also given by inhalation route. Then the third part which comes phosphodiesterase inhibitors. It includes thiophenylline and amyophenylline. Okay, they are given by orally or intravenous route. So there are 2 mechanisms of them. Inhibition of PD, which thereby will increase cyclic AMP and adenosine A1 receptor antagonist. Okay, so due to this there are 2 side effects. Okay, first side effects of PD inhibition. What are PD inhibition? Nausea, vomiting, headache and arrhythmia, and sometimes diarrhea also it causes. So you can add here in your notes that diarrhea also causes. And due to adenosine 1 receptors antagonist, there are 3 side effects: arrhythmia, diuresis and epileptic seizures. So you can remember by ADE and ADE. So these are the techniques by which you can remember these side effects. So next to leukotrienes affecting, which have we studied. First we studied for bronchodilators, then to LT receptor we have to stop that reaction. So leukotriene affecting drugs. So phospholipids, which is converted to arachidonic acid, and then arachidonic acid by SOX and LOX by, here it will produce prostaglandin and here it will produce leukotrienes, which leukotrienes will develop in leukotriene receptors and then bronchoconstriction. This is how the pathway is there. Okay, so how you will stop this pathway? First you can give steroid here, so phospholipid will not convert into arachidonic acid. Then second you can stop here, by which arachidonic acid will not convert into leukotrienes, and third you can stop the receptor here. So what medicine you will give first? Now we will study one by one. So first is steroid. Steroid is used for prophylaxis. It is a drug of choice for prophylaxis, and it is also used with bronchodilators to increase the sensitivity of beta 2 agonist. Okay. The next one is LOX inhibitor. So there is one example of LOX inhibitor is Xylitone, and then the last one is LT receptor antagonist. So there are two examples of them, Zaki-Lucas and Montelukast. So you must remember that we are giving Montelukast for bronchial asthma many times. Then the third part is, we said, mast cell stabilizers. Okay, so mast stabilizer, there are two examples, sodium acrylate and neurochromil. Okay, they are only used in prophylaxis, not in acute attacks, only in prophylaxis, and given by inhalation route. And the last one is omalizumab, which is a monoclonal antibody for IgE. So the antibody antigen will not react, so it is given in prophylaxis and it is given subcutaneously. So these were the four things you must remember. So just we'll go through one by one now again. So far we studied bronchodilators, then drugs affecting LT like leukotriene receptor, then we studied mast cell stabilizers, and at the end we studied Montelukast or monoclonal antibodies, which are stopping the reaction of antibody and antigen.